welcome back to Two Be Told Podcast. I'm Erica, and this is Brandy.
Hey, hey, hey.
You like how I said that? And this is Brandy.
Yes. You getting that,
I know.
announcer voice on.
I know,
Get
right?
it.
Like I'm on the radio. Well, that was my dream at one time, to be on the radio.
Was it now?
It was. It's
I
in my bio. It's in my bio.
Okay, I didn't know
Remember?
that.
You remember I was an intern at a radio station?
I do remember that. Yes, I remember that. I do remember that. Okay,
Yes.
Well,
all right, but
get
anyway,
all your practice up in here. Get your
yes,
practice here.
I am. I'm getting all of that out. Okay. So anyway, this is our restorative series, right? So last week we did root canals. This week we're doing fillings. Okay. But if you guys are the first time viewing with us, this podcast all about helping people, especially the underserved and underprivileged, particularly people, Black and brown people, with their dental health care needs. Okay. All right. So now let's go on to what I've been doing is, first episode, I do a little research of my own. So of course I looked up fillings. Because some people have never even had fillings, and I'd be looking at them
That's
like,
true.
what? Good for you. But it ain't me. It ain't me. Right. So I looked up a definition, which I thought was really good because some of these definitions are not in layman's terms, and they're like, it sounds like a bunch of like Ferris Bueller's teacher, wah, 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 or Bueller, or whatever. Anyway, so a filling is used to treat a small hole or a cavity in a tooth. To repair a cavity, a dentist removes the decayed tooth tissue and then fills the space with filling material. Now, why would someone need a filling, Brandy? I guess it describes it in the definition, but you give us more details.
It does. It's a little superficially, but it does. So if you have decay in your tooth or a cavity in your tooth, you may need to have a filling done, depending on the severity of the cavity. So sometimes you'll have very small cavities. The very beginning of a cavity, that's called incipient decay. So very beginning, and those are just watched. So like from appointment to appointment. So in 6 months, the doctor might say, you know what, let's watch this. We're not going to do a filling because sometimes the incipient caries or cavities will repair themselves. So like if you like if you're using like fluoride mouth rinse or like a prescription fluoride toothpaste, those very beginnings of the cavities can easily repair, but you got to be like, on it with those things.
Diligent.
You got to be really diligent and consistent.
What's it called again? Incipient
caries or incipient decay.
It's one of those $5-10 words. Okay.
That's all they know how to do.
I know,
like, I mean, I don't know
why the words are like extra.
Yeah, but the words are extra. Yeah, but that's the beginning part. But so you will not have to have fillings for those. Those will be watched. But if you have a significant cavity, one that is either causing pain, a lot of times people don't have any pain when they have cavities, and they'll say, "Oh, well, it doesn't hurt." But it hasn't gotten into that pulp. So we talked about that last week with the root canal. It has not gotten into the nerve. So that's why it's not necessarily painful. You might experience sensitivity to like sweet, or you might have cold sensitivity. Okay, so that's how you'll know. Or also if you have a fracture or a tiny fracture in a tooth, if you broke a tooth, a front tooth, a back tooth, eating something, you'll need to have a filling done to repair those areas. So that's typically why you would need to have a filling.
Okay. All right. So I don't know why I keep thinking about Pulp Fiction every time because we're saying pulp.
Because we're saying pulp.
Pulp. Or pulp in the orange juice. So, all right. So next question is, what does the procedure entail?
Okay, so when you are having a procedure done, a filling, mostly any restorative treatment, and I didn't mention this last time about root canals, but you should be getting numb. So you're going to be anesthetized with the Novocaine. So there'll be a few injections, and then after that, you should be comfortable. If not, you can always let your dentist know they can give you more numbing medicine, but you're going to get numb first. In some cases, patients don't get numb because the cavity is very small, and some patients don't like to be numb. They like hate it. And I've known many patients who are like, don't give me the numbing. I just want to get the filling done, and we'll have a filling done without numbing. But like I said, those are very superficial cavities.
Okay,
So
because
yeah, it's very rare. But or sometimes if kids are really small and they have like a tiny cavity in a baby tooth, they won't numb because it's harder to numb a child, giving them injections than it is to, to do the filling. But anyway, so for the most part, you will get numb. There'll be a lot of vibration and water spray. The doctor will use his instruments to remove the cavity fully, and then fill the tooth with a filling material, either a silver filling, the amalgam filling, or a tooth colored filling, the composite filling. Yeah, so that's basically it. And then they'll adjust your bite. So sometimes when you have fillings placed, it will feel very high when you bite your teeth together. Yeah. If you leave the office like that, you will be in a lot of pain within a few hours the next day because your teeth are hitting over and over again. So all your biting forces are going onto that one tooth. So they will check your occlusion or your bite with a little paper, and then they'll remove it and get it nice and even so that when you bite your teeth together, they go together. And then you should be good. They'll polish it up and you should be good. They'll check the contacts. So they'll make sure that you can floss in between the area, that there's no filling material in between the teeth. Floss should go in and out pretty easily. There's several surfaces on the teeth. So sometimes a filling can be one surface. It can cover a tiny portion of the tooth, the whole tooth. I think that's the gist.
Yeah.
That's the gist.
So what are the risks and the benefits of getting a filling?
Okay, so the benefits are, of course, we're removing the decay. So if you were having any pain or sensitivity, discomfort, that will be done with for the most part. Sometimes when you get a tooth colored filling, you can have sensitivity for a few days or so until your tooth adjusts to the filling material. So the filling material and enamel kind of conduct a little bit differently. So you might have a little sensitivity, but that should go away within a few days or a few weeks, depending on how deep the cavity is. Sometimes it can be aesthetically pleasing. So if you're having a filling done, you may look a lot better afterwards if you had, a lot of visible decay, especially on front teeth, and it'll feel better. Yeah. So the risks are sometimes if the cavity is really deep, then you may have to have a root canal. So they don't tell you that once you get a filling, you're more susceptible to having cavities on that tooth again. So the tooth is no longer intact. It no longer has its original material, the enamel, which is the strongest surface in the body. But once you have a filling done, you breach that. And so now there's always a way that you can get cavities with a micro leakage into the tooth. So there's little microscopic areas that can, your food can seep into your saliva. So you're more likely to have a reoccurring cavity on that tooth in the future once you have a filling.
Well, also,
hold on. Also, the other thing they don't tell you is that if the filling is really large, you may need to have a crown done at some point. So if your filling is taking up most of the surfaces of your tooth, then there's a chance that you may need to have a crown in the future. That's if it's a very large area of decay.
All right. So that is our series, or that's part of our restorative series. We did fillings today. Next week, the following week, we'll have something else for you guys.
I think we'll do crowns, Erica.
All right, guys. Don't forget, follow, like, and share. toothbistropodcast.com. Check us out. Subscribe, like, share. Yes. All right. Tune in next time. Bye.
Take care.